That's not something you get in your teacher training to deal with students that are having a mental health crisis. We weren't equipped with that.
It is my experience that if you talk to young people and promise them that you will take their ideas seriously, they will give you serious thoughts and serious ideas.
Now we have a national crisis in terms of fatherlessness. I was a child who helped my mother bring home the groceries. She raised 3 boys in the South Bronx by herself. And she's my hero in a lot of ways, but it was a very hard life.
Hey, it's Julie, and this is Top of Mind, where we tackle tough topics with nuance and an open mind. We're out to become better citizens, kinder neighbors, and more effective advocates. Today, how can we do better by America's kids?
We could sense that the tide was shifting even pre-pandemic to students really struggling with mental health, and we didn't have the tools to handle that. We just knew we are dealing with kids that are in a different space mentally than we've ever experienced before. My name is Jen Schnormeyer, and I am the high school instructional coach here at Gilbert High School in Gilbert, Iowa. We see a lot of anxiety here. Our students have very high expectations of themselves, and not achieving those self-imposed, usually, expectations is really hard for our students. Depression has become more prevalent and more talked about. For us, we would notice kids kind of sinking into that quiet, reclusive behavior more often than we had pre-pandemic. So the teen mental health first aid steps are look, ask, listen, help a friend. And we kind of make that into a little rhyme. Look, ask, listen, help a friend. And they snap. And the first time I did it, the kids just looked at me like, what is wrong with you? And then I was like, no, we're doing it. We're doing it every time. And we actually had an all-school assembly. And I was like, okay, those of you that had me for class, we're going to show everyone else how we do the little song, the chant. And they did it. And it's great because they remember that. To me, that's at the heart of teen mental health first aid, is to let people know that they are cared for and that they are loved. And if they need help, they can get it.
In too many ways, kids in America right now are not all right. They are the poorest age group in the country, with roughly 1 in 7 children living in poverty. That's according to the U.S. Census. 40% of high school students in America say they experience persistent feelings of sadness or hopelessness. That same data from the CDC shows 1 in 5 high schoolers have seriously considered attempting suicide. And kids are struggling academically, too. Even though we're years beyond the dramatic learning losses caused by the pandemic, a third of students in U.S. public schools ended the 2024 school year behind a grade level in at least one subject. So look, it is a grim picture. But science and just our daily interactions with young people tell us that kids are resilient. And for all of our disagreement as a nation, I think it's pretty clear that we all want children in America to thrive. So how can we do better by them? Well, today we're going to hear about 4 different interventions to improve outcomes for our kids, starting with their mental health.
So we actually first did our training in 2017, and all of our 6 through 12 staff was trained in youth mental health first aid.
Mental health first aid was created in Australia 20 years ago as a training for adults who work with children. It has since spread around the world. Jen Schnormeyer and her colleagues at Gilbert High School in Iowa are among the millions of people now certified in mental health first aid.
Yeah, so just like if I came across an accident, I might try to apply my best medical first aid. In that moment, I am not a trained paramedic or a trained doctor. I'm not going to perform surgery. This is very similar to that. You assess the situation, you ask this person, are they okay? What's going on? And then you go find help. I think 5 years ago was when the floodgates opened of, talking about mental health was really just becoming more normal and becoming more accepted in the world that we live in. And, we weren't equipped with that. That's not something you get in your teacher training to deal with students that are having a mental health crisis, or to deal with the student. Part of the thing that we did in the mental health first aid training in 2017 was we role played what it would be like to have a mental illness where there's voices in your head that are really just talking negatively about yourself, and how difficult it was for me as a person experiencing that, to have a regular conversation and go through my daily activities with these nagging thoughts of self-harm or that I wasn't worthy or any of that. And, there were a lot of teachers after that 2017 training that said that was one of the most worthwhile trainings I've ever been to. I'm so glad I spent my day doing that, and came away from that with just a new perspective on the struggles that not just teens, but people are having with mental health.
But then the COVID-19 pandemic shut down in-person learning and frustrated their efforts to implement all of this training they'd received.
In that time, there wasn't a lot of adult connection. Students really relied on each other. So coming back from that, we wanted to make sure our peers or our students could see in their peers these warning signs of this mental health challenge, and then felt empowered to go find an adult and get them involved, and don't take on that role of being the therapist. Don't think you can do it all on your own, because you can't. And we have plenty of resources that will get your friend the help that they need.
Schnorrmeyer's school district learned that mental health first aid also had a version of the training for teens. So they got to work teaching it to all of their middle and high school students.
The thing that I like most about the teen mental health first aid is its systematic way of approaching what to do. Our students in general are good to each other. They listen when they need to. But this really gives them a way to know when to get help, to get that adult involved. You can know when something isn't right with your friend, and it's okay to acknowledge that and then get them help. Whether that's calling 911, whether that's calling the suicide hotline, whether that's calling our student assistance program that all of our students have access to.
You might worry that this would create a situation where it becomes sort of this surveillance thing. Like, now, I have to be careful what I say because my friends are going to report me, that kind of thing. So how do you address that or avoid that kind of situation?
We have had quote unquote false alarms. And there have been moments where a kid's like, that was totally taken out of context. But, we say to the kid when we bring them in and ask them a question, like, is this true? Or how are you doing? Is everything all right? And, we'll say this person said this because they care about you. They didn't say it to get you in trouble. And I think that is the culture of caring supersedes the culture of spying. And I'm so grateful that we have invested in that in our school, because I do think it's making a difference in the way kids are toward each other. We see that in the lunchroom. We see kids being more friendly and inviting kids to sit with them. We see kids coming to us and saying, I'm worried about Susie because she hasn't been acting herself, or I noticed Susie's been cutting and I'm worried about her. So we have seen more kids come to us than ever before with those type of concerns for their peers.
What's a skill, a first aid intervention that you teach the teenagers there?
So the teen mental health first aid steps are look, ask, listen, help a friend. Look, ask, listen, help a friend. So look, you want to take in, what do you notice about your friend? Are you noticing something different in their behavior, their actions? And is whatever this change is disrupting their normal life? So we talk about, everybody has bad days. Everybody has bad moments. But when your friend or you get to the point where that negative is hindering you from doing the things that you love. For example, a student really likes basketball. Well, if you're not sleeping well, how is that going to impact your basketball? If you are having negative thoughts about your body, how is that going to affect your ability to play basketball? And then we talk about if you have a day of that, okay. But if you have a week or 2 weeks of that, then that's really when it's a time to intervene and get this student some help. Mm. And you need to know your people around you to know what is normal and to be able to say ooh, they were one off today, but I've noticed for 2 weeks, my friend hasn't eaten lunch. I need to get them help. Ask is the second step. So that now you're going to ask that friend, are you okay? I've noticed you haven't been yourself. What's up? What can I do to help? And in the training, we talk about, your friend might be like, everything's fine. Well, you might have to come back and say, I don't know that it is. You just don't seem yourself. And maybe they'll continue to not tell you, which then that goes into the listen. Like, then you need to listen to what they're saying. And if they're saying, no, everything's fine, well, it isn't. It might be time to just go to help a friend, or if they do divulge to you what's going on and what they're upset about, then, be a good friend and just listen to that and, help them through if you can. Talk with them and encourage them to keep going and that you care about them. That's one of the big things we hope students get from Teen Mental Health First Aid is that letting people know you care about them is a huge asset that we need to do more of in general. And that's something we've really seen an increase of here. And then the next step is help. We try to equip our students during the training with various ways they can get help. But we tell them, you are not the therapist. You are not the psychologist. You can't fix this for your friend. You need to get an adult involved.
Are they receptive to that?
They are. They are receptive to that. We know research tells us that peers are more likely to go to peers. And from there, you have to communicate. The hardest part is, and we know, I'm sure you had a situation where a friend said, well, don't tell anybody I said this, but...
Exactly. And you don't want to be the one that is betraying the trust of your friend.
You don't. But a phrase that we heard during our instructor training was, your friend's life is more important than their secret. If they tell you they're thinking of suicide, you have to tell an adult, like, their life is more important than you keeping that a secret. And you can't save them on your own. And that is something we just try to encourage kids, like, you have to tell someone even when it's uncomfortable.
Suicide is something that I think is scary for all of us to think about trying to help. If someone you love, someone you care about tells you that they're contemplating suicide, I think a lot of us panic about what do I do in a case like that? How are you training young people to address concerns of suicide among their peers?
So that is one of the things that we did both. And actually, each of the trainings that I did, we had to ask a peer, just flat out, are you thinking of suicide? And I remember it was so awkward and uncomfortable. And I started laughing when I did the role play. And then during the training, we actually put the two questions, are you thinking of suicide? And are you thinking of harming yourself up on the screen? And we have the kids read it as a group. 1, 2, 3, we're going to read this question. And we tell them asking a person about suicide does not put the idea in their head. In the Teen Mental Health First Aid, they say research shows that's not what happens. So if you ask them that, first of all, they're likely to answer honestly. If they feel that you care about them, they're going to answer yes, if they truly are. And I do think it's difficult because as a friend or as a caring adult, you don't want the answer to be yes. Because from there, the emergency of the situation becomes more apparent. We have a protocol, you don't leave the student alone. All of that just comes into play, and it just feels heavy when the answer to that question is yes. And as a friend, I think that would be really difficult as a teen to hear your friend say, yeah, I am thinking of suicide. And then what do you do after that? And so that's where, we tell them, go get help immediately. Call 911. It's okay to call 911 if you're worried about your friend. It's what you have to do to get them the help that they need. But I do think that is a really difficult question that we have them practice so that they're ready in that situation.
Can you tell me about a payoff moment that you've had as you've been going to all the trouble to implement this program and get all of the teenagers in the school district trained up?
Yeah, so recently I got a text from a parent kind of later at night, and it said, hey, my student is worried about student B, and can you reach out to the mom and make sure everything's okay? And I said, absolutely. The student had posted some things on some social media that were concerning, and I reached out to the mom, texted her, and we were able to connect. But also, other students had reached out to the mom and had asked her to go check on the student as well. And for me, that was a huge payoff moment where our students are taking that look, ask, listen, help, They did it. Like, they did exactly what they were supposed to do. When you're worried, you get an adult involved and you let them handle it. Like, you can't handle this on your own. And I was so proud. It was like 11 o'clock at night. I was so proud of these kids for doing exactly what we told them to do. And, the kid is getting the help. So it was a moment where I felt really good about the time that we spend in class and that they came away with that and did it.
As a parent yourself of a high schooler, what would your advice be to parents who have teenagers who maybe they're not in a school where this program is actually being implemented? Are there lessons from this program that you think families could implement themselves?
Oh, 100%. I think, the steps, look, ask, listen, help, a friend, anyone can do that. Any of us can be a shepherd for those of us around us, whether we know them well or not. But I think parents can sit their kids down and say, here you go. We are going to put the suicide hotline in your favorites on your phone. We're going to talk about who are adults that you trust. And I think that is a lesson any of us could teach at home or at school or anywhere is, if we see something, we need to try to help that person.
Did you use the word shepherd just a moment ago?
I did use the word shepherd.
I love that word. Talk to me about why that word would come to your mind.
Because when I think of a shepherd, I think of someone who tends to a flock. And that is something that I feel here at Gilbert High School, I try to do. I try to care for my flock here, whether that's students, whether it's coaches, whether it's teachers, whoever it is in our building. I want to care for those people and make sure they're here and that they know that they're valued and loved. And when you perform teen mental health first aid, you are being a shepherd for the people around you, and you're making sure that they know that they are loved and cared for, and that you're going to get them help if needed in the same way a shepherd would do for their flock.
Jen Schnormeyer is an instructional coach at Gilbert High School in Iowa, heading up the district's teen mental health first aid training. In addition to mental health challenges, America's kids are struggling academically. The headlines make that clear.
Student achievement has continued to decline significantly since the pandemic.
Math and reading scores have dropped to their lowest levels in more than 2 decades among high school seniors.
We've got the data now, and things are bad. They're actually worse than most of us thought. In fact, I would tell you that we have an education crisis right now.
Okay, but what if the way out of the crisis is to focus less on what kids lost and more on what we learned about our education system during the pandemic? This is Top of Mind. I'm Julie Rose. Hey, it's Julie. If you're like me, sometimes you just need to add a fresh voice to your podcast listening habits, and I've got the perfect solution. It's The Lisa Show from BYU Radio. It's an award-winning, nationally acclaimed podcast that tackles the everyday struggles we all face: parenting, mental health, relationships, social issues. Lisa Valentine Clark is the host. She is a widowed mother of 5, and she knows firsthand how messy life can be. So through honest conversation, hard-won wisdom, and a good dose of laughter, she reminds us that we're not alone. So take a good look at life, as she likes to say, and tune into The Lisa Show. You can find it on byuradio.org or any of your favorite podcast apps.
It's absolutely fair and valid to be thinking about things they missed, but we always want to be really attentive to the strengths that we can build on, because those are ultimately the assets and resources that help kids grow.
This is education researcher Justin Reich. He's head of the Teaching Systems Lab at MIT and host of the Teach Lab podcast.
A very strong belief I have is that when we in education are not sure the way forward, one of the very best things that we can do is talk to young people. It is my experience that if you talk to young people and promise them that you will take their ideas seriously, they will give you serious thoughts and serious ideas.
Which is precisely what Reich and his colleagues at the Teaching Systems Lab have been up to the last few years. As the pandemic started in 2020 and schools scrambled to adapt, the lab began surveying students and teachers all across the country. They hoped to glean lessons that could make schools better, even than before COVID.
This is a generation that learned an enormous amount about technology-mediated communication, about learning at a distance, and other things that will serve them throughout their whole lives. One of the things that young people experienced during the pandemic was a really heightened sense of autonomy in their learning. Kids ate when they wanted to. They drank when they wanted to. They went to the bathroom when they wanted to. They took little naps when they wanted to. They wore sweatshirts to school, and some of those sweatshirts even had hoods on them. And even with a hooded sweatshirt, young people were able to learn. As these students came back from 3 months or 6 months or a year of having that autonomy, there were a lot of teachers and school leaders and students asking good questions about, like, why do we have rules against hoodies in school? Like, who are we? We all learned fine with them when we were at home. Why can't we leave them on here? And we've talked to another number of principals who've decided that some of those rules and constraints are things that they didn't want to have to focus on anymore. Enforcing unnecessary rules is just a thing that takes a lot of, it takes teachers time to decide whether or not they're going to say something. It takes teacher time to talk with a student. It takes teachers time to get principals and other kinds of folks involved. And so, one of my colleagues in Boston, Nima Vashia, asked the question, what are the rules that we have that are about learning, and what are the rules that we have that are about control? And how can we find the rules that are about control and maybe think about, leaning back on those?
Meanwhile, Reich's team found that the pandemic caused teachers to lean in to new opportunities for connecting with students and parents. Many were given time to do home visits or the flexibility to hold parent-teacher meetings virtually during the pandemic, and hoped to see that continue after.
Many teachers told us that the pandemic reinforced for them the incredible importance of relationships for learning. And when we feel connected, when we feel safe, those are precursors for good learning. I have a colleague, an amazing math teacher who works in the Boston Public Schools. He grew up in South Central LA, had a challenging childhood, became a math teacher. And I'd had conversations with him before the pandemic where he said, I teach, advanced math classes, and maybe my kids are in tough circumstances, but when we come to class, we do math. We leave the rest of our lives at the door and we come in and we do math. And the thing that he told me after the pandemic was, when I had a chance to see where kids were learning and what they were doing and what they were dealing with through the lens of their laptop cameras that were in their homes, I really thought differently about those beliefs. One of my local elementary school principals very early in the pandemic said something along the lines of how much we had taken for granted school buildings. He said, in the before times, we brought 300 students together in one place to learn. And all of them sat at the same desks, in the same chairs, the same tables, the same equipment. And at that point in the spring of 2020, he said, now we're trying to create learning experiences for 300 students in 300 different places. And we know those places, those environments they go to learn are really different. They're, in very basic ways, they're kids who have their own rooms, and they're kids who share rooms with other people. They're kids who live with lots of adults around to support them. They're kids who are the adults, who are the caregivers who have to take care of younger siblings. In some of the very earliest reports, we did a study where in March of 2020, we read all 50 states' initial guidelines for emergency remote learning. And there are another number of state policy documents that called for grace, bringing a sense of grace to the lives that young people were leading, which is not, I don't know if you've ever read things that are produced by state departments of education, but they usually do not refer to grace as one of their sort of key ideas. They usually refer to things like adequate yearly progress. And
rigorous standards.
Yeah.
Professional development. So is that principle that you were just referring to thinking differently about the role of the school building? I mean, the school can't be all things to everyone, but are schools trying to, or doing more, do you think, or could maybe do more to address some of the inequities that their students are experiencing?
I mean, in many respects, I hope not. I talked with a group of principals and was saying to them, this cannot be your job. fixing inequality cannot be your job. And some of them pushed back and said, look, Justin, this is the work. This is the work right now. Like, our kids are missing these opportunities. And so we just have to provide these social services for them.
So let's provide food pantries in schools, or let's provide, safe places while your parents are at work. One of the kids, even in one of the studies, there was like this question, like, what do you like to see change, when you come back next year? And one of the kids is like, I'd like a pool.
Yes. And, and that, we laughed the first time we heard that. And then we do what we try to always do when we talk to young people, which is to take their ideas really seriously. And part of what he was telling us was that in his world, the challenges of the pandemic were just a continuation of the inequalities that he saw around him every day as a kid growing up in urban Boston, looking out at the very affluent suburbs around him. But it should not be the job of the local principal to figure out how kids get a swimming pool or really how they get fed. Like other municipal officials, other state officials should be taking that on so that schools can focus on their most important function, which is teaching and learning. What this generation actually needs is generational support so that we're not just trying to catch them up in the next 6 months, but we're recognizing that it's really going to take a generational effort to make sure that they move into adulthood strongly and smoothly.
So what might one of those interventions look like? What would a generational, can you give me an example?
It would involve substantially increasing the amount of funding that we have for public schools. It would also involve recognizing that the social welfare system for children in the United States is among the very weakest in the affluent world, and that, young children should not live in poverty, just like we decided a few generations ago that senior citizens should not live in poverty. And we developed Social Security and Medicare, which have been enormously successful at reducing the poverty rate for the oldest Americans. We should make those same kind of efforts. We should also make sure that young children have healthcare. We should make sure that young children have mental health support. We should make sure that they're ready to learn by making sure that they have computers at home, that their homes are connected to broadband. And I think it's enormously important that all these things should not be done by schools. And it is really not a moment to be asking the question, what else can our schools do? Because our schools and school staff are completely tapped out. You have to understand how utterly exhausted America's teaching force is. If you're in a situation where school staff are exhausted and where schools aren't working the way that we want them to, you actually can't solve that problem through addition. You can't solve that problem by saying, okay, what else are we going to ask people to do to make this better? You have to start, which is counterintuitive, with what can we take away? What can we take off of teachers' plates? What can we take off of schools' plates? What are ways that municipalities, that states could step up and take over some of the things that schools are doing right now so they could have more breathing room to focus on their core competencies of teaching and learning?
Justin Reich is a faculty member at MIT, where he runs a research group called the Teaching Systems Lab. He's also host of the Teach Lab podcast and author of Failure to Disrupt: Why Technology Alone Can't Transform Education. Now, the COVID pandemic also accelerated a cultural shift around schooling that continues to plague the ability of kids to succeed.
Chronic absence increased exponentially.
This is Hedy Chang, executive director of Attendance Works. It's a nonprofit initiative focused on reducing chronic absence.
So before the pandemic, there were about 8 million, or about 16% of all our students who were chronically absent. And when I say chronically absent, I mean missing 10% or more of school over the entire school year, or actually at any point during a school year. So that's 8 million kids missing 18 days over the course of a school year.
By 2021, that figure had nearly doubled. And today, in 2026, it has come down slightly, but it's still quite a bit higher than pre-pandemic levels. Chang says the pandemic broke our faith in schools.
Schools became highly unpredictable during the pandemic, not because of anyone's intent, but closures, or even if you stayed open, but now you've got a COVID outbreak, and so you have to close. And whereas schools were sort of this steady thing that families could count on, now they became much more unpredictable for a couple years. But we also lost connection. And that means we have to reestablish trust and reestablish connection to families. We sometimes talk at Attendance Works about how kids show up to school when kids and families have hope for a different future, faith that the school that I'm in is going to get me to that different future. We still have extraordinarily large numbers in middle and high school, and that's very troubling. But the fastest growth and the largest number is now among elementary schools. And when you start to think about the consequences, addressing chronic absence among our youngest learners is really critical because you're trying to build those habits of success that help you throughout your educational career. And also, learning is scaffolded. So if you don't learn, key concepts around reading when you're in kindergarten, it's a lot harder to keep up with reading. That's why chronic absence in kindergarten, especially if it's repeated in first grade, makes it less likely that a child is reading in the third grade. But it's also those habits of persistence. Chronic absence in kindergarten is connected to being less engaged, having less executive functioning skills. Getting kids into this habit of attendance is important for learning. It's also for developing those habits of success. Once you have 20% of all kids chronically absent, the churn that's kind of happening in the classroom isn't just affecting the kid who's chronically absent. Now you have, a number of kids in any classroom missing school. And when that happens, the churn affects both the ability of teachers to teach and kids to learn. Because teachers have to make decisions. Oh, Julie wasn't here today. Hetty was. Do I repeat or do I ask Julie to help Hetty? And now, you're trying to keep instruction engaging. You also now have more disruptions in classroom norms.
What are some of the other primary barriers that keep kids from coming to school?
Certainly, we have chronic and acute illness and a lack of access to healthcare. And, you do see a high level of chronic absence happening more frequently in our lower income communities. So, and part of the problem is they've faced trauma. These were a lot of times the communities that they had essential workers. So the trauma, the poor transportation, the housing and the food insecurity. And even right now, we're seeing an unwinding of, health insurance for kids at a time when we more than ever need kids to have access to preventive health care. So those barriers are huge. The aversion issues, and what I would pull out in there is the issue of anxiety. Kids missed out on key learning, and then they're not feeling comfortable, and then they're feeling anxious. And so we are hearing about that anxiety and mental health issues. Disengagement. We've got a real challenge in many places of staffing shortages. The key way to keep kids in school is for adults to be in meaningful relationships to kids. And when you have staff who aren't permanent, staff who are churning, that is a lot harder. And then I would say in the misconceptions, this issue of does showing up to school really matter?
How have schools traditionally tried to encourage attendance and discourage absence?
Well, I think there's two ways. One is we send notifications out when kids miss school and they say, hey, you missed too much school, you better come up. And I think we really need to rethink how we do those notifications. You have to word them in a very, hey, what's going on? How can I understand the situation? How can I help you? As opposed to blaming families, which then I actually think exacerbates the broken trust. The other thing I think that has been a traditional one is we do attendance incentives, but often we emphasize perfect attendance. We don't want perfect attendance for several reasons. One, I don't want kids who are really, truly sick and who might have an infectious disease to come to school. But equally, and maybe even more, equal important, kids, if you do perfect attendance, even for a month, the kids who are most challenged fall off that bandwagon so quick that they have no incentive to be part of this. You want to do good and improved, or if you're going to do something that's called, quote, perfect attendance, you want to do it for every week because you have to make sure that kids are everywhere, always in the game. And it's not about the incentive itself. You got to be thinking about what are you trying to, behavior you're trying to create. So let's say you do incentives where every time the kid arrives on time, they get a lottery ticket. You're acknowledging them. Oh, Julie, I saw you. You got here on time. Hey, here, have a lottery ticket. And then you, at the end of day Friday, at the end of the school day, you have a drawing for some gift. Incentives well done are a way for kids to be heard, seen, and praised for good behavior. And we have to make sure that we're not actually causing some kids to lose hope.
What do you think is the best message for parents who may be thinking, well, it's elementary school. My kid knows how to read. Missing one day where half the day they're going to be maybe doing an art project anyway, and half the day is taken up with lunch and recess. My kid will do the assignments a couple of days of excuse so that we're doing family things or because it's crazy at home or, whatever, like for all the reasons that hectic life might cause. What would your message to parents be who are thinking, it's not that much lost, and also my kid will do the makeup assignments?
Yeah. So we have this saying about showing up matters for real. And that's, the R is for routines. It is really important for kids to be in regular routines. It actually helps to deal with the anxiety. It helps you to recover from chaotic times. And I would argue that routines help us later on when we're adults because our employers expect us to be in routine and be able to sustain routines. So routines, engagement. When kids are in school, that's their opportunity to engage and build relationships to both adults and to peers. And if you have chaotic times where you're in school or not, it's much harder for your kid to be engaged, to develop those friendships, to develop socially, emotionally. That's what school is so important for. And you develop, even if you have a bunch of siblings, I guarantee your relationship to your siblings is different from how you learn to negotiate life with other classmates. So engagement, and then access to resources. There are resources at schools, enrichment activities, health services, lots of things that you just don't get when you're not there. And then it is important for learning because learning is scaffolded. And while you may be able to make up for some of it, when you're doing a group project at school, you can't make up for that group project at home. And learning is both about what you know how to do as an individual and what you know how to do with other kids.
Hetty Chang is founder and executive director of Attendance Works. Thank you so much for your time today, Hetty. I really appreciate it.
Thank you.
So we've talked about interventions aimed at the mental health and educational challenges facing America's kids. Let's think now about an aspect of life affecting nearly a quarter of children in this country. And it's linked to poverty and poor academic outcomes.
There are more than 13 million single parents in the U.S.
3 times as many single parents report difficulty affording childcare, and single parents report higher levels of emotional distress.
Margaret Gray spent 15 years as a single parent, 1 income, 3 jobs, 5 children. Tough doesn't even begin to describe what the Orlando mom went through.
The United States has the highest rate of children living in single-parent households of any country in the world, according to the Pew Research Center. Nearly 1 in 4 American kids lives in a home with just one parent and no other adults. The vast majority of those are single moms. And that number has been increasing for decades across all races and ethnic groups.
Now we have a national crisis in terms of fatherlessness.
What can we do to improve the chances those 24 million children will thrive? I'm Julie Rose. This is Top of Mind. Hey, Top of Mind listeners, Julie here. So you probably got me in your earbuds right now because this is not the kind of show that your kids are just dying to listen to with you, right? But BYU Radio does have a podcast the whole family can enjoy together. It's called The Appleseed. It's a storytelling show. These are award-winning storytellers from all over the nation who come into the Appleseed storytelling studio and share experiences about gut feelings that paid off, small acts of kindness, even the occasional mishap like dyeing your eyebrows the wrong color. So gather your whole family for great adventures that just might spark stories of your own that you can share with the people you love. Tune into The Appleseed on byuradio.org or your favorite podcast app.
I was raised by a single mom. There was no father in my home, and I always wanted to know why was it that men deserted their families, and that was the way I posed the question as a youngster.
Ronald Mincy is a professor of social policy and social work at Columbia University.
Prior to that, I was a program officer at the Ford Foundation doing research on low-income fathers and families, and it's a passion of mine for most of my adult life. As the middle child, I got to observe what being a single parent was about. I was a child who helped my mother bring home the groceries. She worked throughout her career. She raised 3 boys in the South Bronx by herself, and she's my hero in a lot of ways. But it was a very hard life.
When Mincy graduated high school, he thought he might become a lawyer. So he got a job as a clerk in family court for the state of New York, handling cases of fathers failing to pay child support.
My job was to write the judge's child support orders down, to translate their sloppy handwriting and type it up and put them back in the file. That's what I was supposed to do. One day I realized my mother's case must be in this file. Over the next month or so, I looked for my mother's case. I went to the Mackenzies and somebody else's, and I narrowed it down until I got to the file where the Mincy's had to be. And I went into that file, I found my mother's case, and I found a case about that thick, right?
5 inches.
Right, that described my family history in ways that I never knew. And I was furious. I was furious at my mother. I was furious at my father for what left us, being raised in the housing project in the 1950s and 1960s.
Furious at the choices they'd made.
Furious at the things they did. I was also furious at the child support enforcement system because my mother had to go back into court time and time again, attempting to enforce the financial child support order that he had, and he continued to not comply with that order. And instead of trying to sort of help this family figure out their challenges, it just kept my mother on this rolling course, and my father continued not to comply. I was furious, and I said, one day I'm going to fix this, all right? And N years later, I'm still at that. And so this is my passion. This is who I am.
And the passion is to understand, first of all, why fathers leave.
Why fathers leave, right? And why they don't support their children, and I mean support in a big way.
Those questions and that anger drove Ronald Mincy to become a social policy researcher. They fueled his studies at Harvard and then MIT. And early in his research career, Mincy co-founded a long-running and now famous study comparing children in single-parent households to those with 2 parents in the home. It started in the 90s, and they're still following those families.
The question in the Fragile Families study, now the Future Family Studies, was how does the circumstances of parents influence children's well-being?
At the beginning, Mincy was still very focused on understanding why fathers leave and how that harms their kids. But as the study progressed, Mincy was stunned to realize that he'd been wrong about fathers who are absent from the home, or at least that he'd been painting them with too broad a brush.
Because fathers are non-resident, it does not mean that they're absent. Many non-resident fathers who've never lived with their children are still romantically involved with the mother of the child. They're visiting mom, they're in romantic relationships with mom, and they see her quite frequently, and when they do so, it lowers the household's food insecurity, okay? That is to say...
He brings groceries
he brings groceries or takeout, right? And so for the single-parent household, which is why, I think that whole idea is a misnomer.
Mincy doesn't use terms like absent or deadbeat father. He now sees non-resident fathers as a vital resource to improve the well-being of their children, a resource we've been ignoring, or worse, actively undermining.
It's become very clear to me that the emphasis in social welfare policy with respect to non-resident fathers is to make sure that they provide financial support to their children after the mom and dad separated.
The problem, says Mincy, is the child support system is laser-focused on extracting enough cash from fathers to make a measurable difference in the education and economic outcomes of their kids. But that level of support is just unrealistic for low-income fathers and can even discourage the other kinds of support Mincy says these men are often providing, like groceries and birthday gifts and time spent babysitting.
Mothers and fathers have informal arrangements for him providing financial support to the child. And the problem is when over the first 3 to 5 years of the child's life, the father doesn't faithfully live up to the informal agreement, then mom is required to bring him into the formal system in order to get help.
Takes him to court for child support.
Or she needs housing, she needs food stamps, and for any of those public benefits, she has to surrender her right to child support over to the state as a condition of qualifying for these benefits.
So is the fix to lower our expectations of child support or stop enforcing them in the same way?
There are two things. One, we need to right-size child support orders. That is to say, bring child support orders closer to the ability of these non-college, non-resident fathers, how much they actually are able to pay. And we are already on this road. In 2016, there was a federal requirement that state child support offices all around the country bring child support orders into better alignment with the actual ability to pay for low-income non-resident fathers. So that's one thing. But we also need to marry our expectations about financial provision to helping fathers make sure that the engagement that they have with their children works. When fathers provide financial support at any level, it increases the amount of time they spend reading to their children and in cognitively important activities, but those activities don't matter. It doesn't influence the children's vocabulary, and it doesn't influence their academic achievement in reading and math when they're 9 years old. So we want them to provide financial support within the means that they're able to do so, but we also want to make sure that when they pay money, which is related to how frequently they read to their kids, that reading pays off.
So now, if you could get them doing more of that, even if they weren't paying more money?
Not more, better. So I'll give you an example. I now have a 5-year-old grandchild to whom I read, and I've learned the importance of how to read to children in order to make that reading pay off. My grandchild, whose name is Emmanuel, he's a budding paleontologist. At 5 years old, he can tell you the name of any dinosaur that ever lived. Our favorite book is Tiny T-Rex and the Very Dark Dark. So first of all, if I wanted to teach him something and want him to focus on something that he doesn't really care about, do it through a dinosaur. Okay, ask him, is an Allosaurus bigger than a T-Rex, right? I can get him to focus on these size differences and scale by expressing that question through a dinosaur.
Right.
Secondly, when I read to man, I just don't read to him. I give him an opportunity to interpret the story to me. It's called dialogic reading, right? And I make sure children at 5 years old have very short attention spans. And so when he gets tired of reading, stop. Right? In part, I'm reading to him, I'm hugging him, he's sitting on my lap, I'm holding his belly, and then he'll get tired of that, and I have to often let him lead our interactions and not my leading it. And then I have to release his imagination. So we now move our tiny dark story to the basement. And he says, Granddad, let's go down in the basement and see where the gnomies are. The gnomies are these little creatures, and that's why they're afraid of the dark. And he's now created this whole world that's in our basement about tiny T-Rex and the very dark. And in the end, it will increase his vocabulary, it increase his love for reading and the like. And most 16 or 19 to 21-year-old men who are the non-resident fathers of these children have no idea about how to read to their children in order to enable their children to have higher vocabulary, academic achievement, and so forth.
So how do you teach these fathers to do this?
By inserting them into Head Start programs and early Head Start programs so that they learn to read and do other things with their children effectively. So we have an infrastructure that works mostly with mom to help to improve the school readiness of young children when they are young, because their minds are like sponges when they're young.
Okay.
But we have very sporadic participation in the Head Start program and the early Head Start program around the country. In places where fathers are encouraged to participate, irrespective of whether they're resident fathers or non-resident fathers, we know that improvements in the quality of what they're doing with their children improves their children's academic achievement. And
are they interested? Do you think fathers?
I think when you talk to, I wrote this previous book on, it's so fascinating. It's called Failing Our Fathers. And we match quantitative data with qualitative data. And one of the themes that emerged in our interviews was this notion of educational regret. Right? We wrote this book pandemic during around 2010, during the Great Recession. And many non-resident fathers, white, Black, and Latino, blamed themselves for losing their jobs during the Great Recession. They didn't understand that this was a national phenomenon and that many people lost their jobs. But many of them thought that if I had gone further in school, I would not have been as vulnerable to this recession as I was. And I don't want that to happen to my kids.
Against the backdrop of all this research and advocacy on behalf of non-resident dads, Ronald Mincy realized he still didn't have the answer to the one question that started everything for him. Why did his father leave?
One day I was listening to this radio program, and the program was about forgiveness. And it talked about how people who fail to forgive people who have offended them, sometimes they have lifelong bitterness, right? I wanted not to have that ongoing bitterness about that issue with my father. And so as I was, maturing, I would make sure to go and visit him and to talk with him about, just try to unpack what all of this was about, and tried to get him to talk about the answer, his version of the answer to my question. And I found that it made him very uncomfortable. And what I learned from that experience was there were a lot of challenges in his own life that would force me to reframe my question. He was a sort of a creature, an African-American creature of the Great Depression. He was in the Navy, and when he came home from the Navy, he, like his whole entire cohort, were very disappointed that their service to this country wasn't honored by with a radical turnaround, rewarding them for their service. And so
they were still subject to segregation, legalized segregation and discrimination.
He lived in Harlem, and at one point, he didn't own a home until his house burned down in a fire, and he was able to get insurance benefits and eventually bought a home in a middle-class community in Long Island. And the first time I went to his house, I had 3 half-siblings that I never knew about. And why in heaven's name were me and my 3 brothers raised in a housing project in the South Bronx, and my father lived in this palatial, from my vantage point, home with my half-siblings.
Who had a father in the home. Who had a father
in their home. What sense did this make? And nevertheless, he was a proud man. He was proud to have a son who, despite that circumstance, went to Harvard, went to MIT.
He was proud of you.
Exactly. And I allowed him, despite the fact that that he contributed very little to all of that, I forgave him and I allowed him to celebrate that accomplishment. And then in the end, he passed away, despite the efforts that I had made to reconcile and the like. There was no mention of myself or my siblings, my brothers, in his funeral documents. None whatsoever. And I remember standing in front of his casket. I couldn't ask him, Dad, what happened? Right? And I looked over at my older brother, and he was a different temperament, and said, Ronnie, don't worry about it. Stuff happens. And that was what it was. But I knew that I had done what I needed to do. And sort of my work over the last years was trying to figure out how I could, I think in our society, our views of non-resident fathers are very pejorative. They are pariahs. But I think my own view is that we need to, stuff happens to those men. I understood my father's story as a consequence of what he had, but I think our society's ideas and the way in which we don't provide a way to reconcile those men with their families, to reconcile those men into the community and to give them the support that they need in order to be better fathers to their kids. And I had that personal journey, and my work has been, in part, trying to allow that personal journey to be part of the experience of more men, children, and families in the country.
Ronald Mincy is a professor of social policy at Columbia University and director of the Center for Research on Fathers, Children, and Family Well-Being. He's also a co-principal investigator of the Future Families and Child Well-Being Study. Top of Mind is a BYU radio podcast. Today's episode was originally produced by James Hoops, Madeline McKenzie, and Kimberly Beck, with mixing by Brandon Lewis, Christian Makatel, and Mitchell Towsley. Updates on this episode were done by Abby Karras and Hayden Thompson. I'm Julie Rose. We'll talk soon.